I usually follow instruction very much, and I'm told do this, I do that. The people here are wondering why I'm not in the Wajir stable. So I was given 30 minutes. My first 5 minutes, nataka kujiintroduce. You can identify yourself with this. So usually I don't label this, but because of time, I've done this labeling. Siu is where I was born. It is a village in Lamu, in Pate. I hope you have heard of Pate Island. That's where I come from. Kisumu, these are my in-laws. That's where I'm married. So I'm married in Kisumu. Moyale was my first posting because at that time, the provincial medical officer thought I was coming from here. So I actually told him he's taking me very far from home. But that was my first posting. So Nairobi is the national level where I work. That's my introduction. In terms of function, I'm the head of the Department of Primary Healthcare. Usually, I don't usually say it in English. I usually say it in Kiswahili. But most of the time when I say that, most people get lost. Mimi ndio mkurugenzi wa idara ya utunzi ya afya ya msingi. So those are the three sections. Division of Health Promotion, Division of Community Health, and Division of Primary Health Services and Family Medicine. So I hope tuko pamoja. So I want to thank the organizers of this. For me, this is a very important occasion. Before I continue with my small speech, which I had written but now I don't want to read it because of time, I want to give apologies from Dr. Kim Sitinei. Sitinei is the head of the Directorate of Health Management Information, Research and M&E. He would have really liked to be here, but he had another function that he had to attend. But he called me very early in the morning to give me his talking remarks. So I have his talking points. So briefly, one, I think we all know that access to health services is very important. Secondly, I think technology is a very important part of the ministry and the government. Directly under health, we have the digital health platform that we are embarking on. And with this platform, it will have about 23 modules, including one of them, the commodity module. And this is all to put all the health information together. The government is also going to have a data warehouse where all health information must be there. So for all the partners that are working on the same, and it is health data, they should be linking with us so that we can actually put it under the same place. For us to increase access to services, but more importantly, to bring the synergy that is needed, because we know there's a lot of shortages under human resource. So if this institution, the cadres that in this institution can work together, and especially looking at preventive and promotive health, it will be very important. And we know in this space, the issue of technology is very important, which is one of the areas inSupply is competent and working on the same. Without commodities, we need to be a big challenge. There's a lot of stockouts, there are a lot of problems in terms of distribution and all that. So I think this system gives us an opportunity on how to manage the same. But under the system, I think more importantly to me, is how to bring in people to work together. The synergy and the modules actually to do the same. Many people talk about how can we work together, how do we bring people in terms of coordination and consensus. But actually, when you go through the packages that they have, the learning packages, it actually does that quite well. And I think we'll hear about the impact teams. I think for us, as we're implementing our community health strategy, we are currently focusing on operationalization of the community health units. And one of the main important components under this is we are having the community health kit. And when the community health kit becomes available to all the counties, it will actually find that already there's something or a system that we can manage the same. I think last thing I want to talk about is sustainability. I think it will be very unfortunate if we start something and then we cannot sustain the same. So hopefully from these discussions and from the people, the counties that have been implementing, they're actually focusing on how they'll continue, even if inSupply moves away or there are no other partners, so that we can actually integrate and mainstream the same. Nashukuru, And I was not told to open this officially, but I take that mandate. I've opened the workshop officially. Asanteni sana.